and there's other causes of middle back pain. It could be your kidneys.
Right, so people will hold, like in this posture, they'll put their hands right there and they'll think they have kidney pain.
Right.
But usually that's accompanied by frequent urination, burning urination, change in the color of the urine, and things like that. Although females, I will say, have a higher propensity to have urinary tract infections. So on women, we will check urinalysis on them because it could be as simple as a urinary tract infection that's giving you referred pain into the back like that. But usually when people tell me I have kidney pain, it's really back pain, and we look at that. Cancer, as I mentioned, you don't want to miss that, and people that are at risk, we want to make sure that we're checking imaging of the spine, for example, with an MRI to look for any metastasis. Next category is fractures.
Is that like a rib cage fracture that might feel like back pain, or?
No, usually not a rib cage fracture unless it's trauma, like a motor vehicle accident. Certainly could give you rib cage pain, usually on the side or in the front, but also in the back, because the rib wraps all the way around and connects to the back. So anywhere along that distribution. But compression fractures of the spine in women that are osteoporotic, that's a big concern. And people that have osteoporosis, it doesn't take much trauma for them to get a compression fracture of their spine. And it's very debilitating, very painful. They can't move. They usually wind up going to the urgent care or the emergency room, and imaging will show a fracture of those vertebrae.
And that seems to be very common, that sometimes, especially for women, they might think it's back pain only to find out it's osteoporosis later on.
Right, they find out they have osteoporosis. Usually they find out sometimes when they get that first compression fracture. And they didn't fall, they didn't bend, they didn't twist, it just moved in a certain way and the bone just reached its breaking point. And with osteoporosis, the bones are demineralized, so they're soft and they easily can get compressed, and the nerve endings are there.
Right.
And they're very painful. You have to put them in a brace, and sometimes if you don't tolerate a brace, we can inject cement, a bone cement, called methyl methacrylate into the bone, and it stabilizes the bone so it won't compress any further.